I want to welcome everyone out this morning to the Family Health Center at North Clayton High School. A lot of planning and preparation has gone into play to get the center ready and open and ready to serve our students and the people of this community. Thank you for coming out. And again, once again, Lonnie Farmer Principal, and I welcome everyone out this morning. Thank you. I'd like to bring up our Superintendent of Clayton County Schools at this time, Ms. Lavinia Jackson.
Good morning.
Good morning.
Welcome again. Thank you, Mr. Farmer. Outstanding. And new, very new to the principalship. What, 2 weeks?
3 weeks.
3 weeks now. All right, so we thank you. And we thank you all for being here this morning. And first of all, I'd like to say thank you to our Board of Education. And we have our chairman, chairlady, chairwoman, with us this morning, Ms. Pam Adamson, without whom all this could not be possible. Ms. Adams, Dr. Adamson, would you please stand? Thank her for leading our board. And we have some other guests with us. Ms. Maya Dubose, thank you for being with us, who is from Congressman Scott's office. So thank you for being with us. We have from the city of Riverdale, Mr. Ansel Davis. Mr. Davis, I think, yes, there you are. City council member from Riverdale. And we have with us Cynthia Stamp Jones. Is she here with us? There you are. Thank you for being with us. Also, council member of Riverdale. And those are the cards that I have right now. So, and then all of you are our honored guests as well for being with us today to share this moment. We are the first school-based health center in Clayton County and the first high school school-based health center in the state of Georgia. That is fantastic. So I want to take the opportunity to say how proud I am to be here today for this historic occasion. And while we're cutting the ribbon today for the health center, and this becomes the first center, as I've said, and the 7th comprehensive school-based health center in the state of Georgia. So its presence here represents a very purposeful opportunity and a commitment for helping our students succeed in every way possible. So I cannot say enough about the splendid work of our district, particularly, however, Tamara Foley, Dr. Foley, would you please stand? She is our Executive Director for Teaching and Learning and the members of her committee. She had a very fine committee working with her. They've worked in harmony to make this happen, and we are pleased to join them with the family health centers of Georgia in offering quality health care services for our students and our families. The center will provide on-site care for acute and chronic illnesses of school-aged children to the students and staff. And that's an important piece too, to know that we're caring about our employees as well as our children. I know the students of North Clayton Middle School, Northcutt Elementary School, and West Clayton. So these.
Angel please report to the main office. Angel Henry.
Now keep in mind you are at a school, so business is going on as usual, and that's educating our children. And so these are the schools that are aligned, and these are the feeder schools for this high school. We know that a healthy student is better equipped for academic success, and that's what this is all about. The Family Health Center here at North Clayton High School will provide our students and their parents an opportunity to address health issues very quickly, and the health issues that might not be addressed otherwise. As one can imagine, the availability of immediate health care is a crucial element for this center, and it's our hope that our students, upon receiving treatment and assistance through this facility, will be able to return to class ready to continue the learning process. As a result of work of these caring professionals, we anticipate a reduction in absenteeism, which will promote academic engagement, leading to increased student performance. And it's all about keeping the children in school, and we know that. I take this opportunity to express my profound appreciation to everyone associated with bringing the concept of the school-based healthcare center, from the drawing board to the dreams to the bricks and mortar of reality. And it is my hope that this is but the first of multiple collaborations with organizations such as the Emory University Department of Pediatrics, Urban Health Program, and the Family Health Centers of Georgia, as we look to expand the availability of school-based health centers across our district. And I know Dr. Johnson's here as well as others, and I think you all will be introduced at another time in the program. But I just want to say thank you so much for all your diligence and all your working hours. And I know when I first met you, it was like, you know, we're not doing this, we are not doing this, and so now we are. So it does take a little time, but with the diligence and perseverance, we can make things happen for our children. And so that's what we're here for today, to make sure that greater things are happening for our students, and to let everyone know that great things are happening here in Clayton County. Thank you.
This has been an extraordinary journey. When I met Dr. Foley, I guess about a year and a half ago, and she applied for our planning grant, which is what we do to expand school-based health centers throughout the state of Georgia. By the way, my name is Vita Johnson. I'm director of the Urban Health Program. You know, like many others, I figured, you know, she had enough energy and enough excitement to sort of move this along. I had no idea the level of energy and the level of excitement that she had, and her ability to convene all of the stakeholders in Clayton County together to identify the needs of their children, of your children, to come up with a strategy to address it, and to go through the whole process of planning to bring us where we are today. Dr. Foley has been your champion. She has been the backbone behind this initiative, and I just want to thank her for all of the extraordinary work that she's done to bring this to fruition. Thank you, Dr. Foley. So I'm a pediatrician by training. I always say I'm a social worker from another life. And I happen to think, after having done this work for over 20 years, that school-based health centers are probably the best model of health care for underserved children anywhere in the United States of America. I've done every aspect of service delivery. I've worked in primary care clinics, I've worked in community health centers. Dr. Brooks, no, Schlegel, community health centers. I worked, of course, in hospital-based clinics. I've even worked in private practice. And I have come to understand that school-based health centers have a very unique position in our healthcare system. First and foremost, they actually address the needs of children in a way that really affects not only their health, but their academic success. They eliminate all the barriers you can potentially think of for access to health care, whether they're hours of operation, whether it's the transportation, whether it's the fact that parents don't know how to navigate the system. School-based health centers accomplish all of those things. The other important aspect of school-based health centers is that they convene this multi-interdisciplinary approach to caring for children. Whether it's behavioral health, whether it's physical health, whether it's oral health, everybody works together from the school side, in addition to the healthcare organization side, to address the needs of its children, and that's extraordinary. And finally, school-based health centers are unique in that we get to see children in the context of everything that affects their lives. It's just amazing. I always say I get to see children in the raw. You get to see their interaction between the school system, you get to see their interaction between their families, you get to see them in the context of everything, and so you can intervene in a very, very effective way. There are over, we think at this point, 2,500 school-based health centers in our country. For a long time, for about 15 years, there were only 2 in the state of Georgia, and we actually ran those through the Department of Pediatrics, but now there are going to be 7. And that's extraordinary for us, and we're really excited about it. We want to bring special attention to those partners who have labored along with Dr. Foley in bringing this to fruition. We think of Kaiser. I'm trying to think of his name, Quintez. Quintez has been part of the advisory group. He's been working alongside the Clayton County school system on many other initiatives. and he has really contributed to bringing this to fruition. He, along with Madeline, have actually funded a behavioral health person who's going to be working at the clinic over the next 18 months. And that's extraordinary. It's extraordinary in that we define health not only as the physical health of an individual, but also the social and the emotional health. And we know that our children would benefit tremendously from this. We also want to recognize the folks from WellCare. Beatrice Futz is here, and she met with us a few months ago and said that they wanted to be involved in the initiative that's taking place here, and so they have contributed also to help fund the behavioral health person here at North Clayton High School, School-Based Health Center. So we just, I don't know what to say. The first high school in the state of Georgia. It brings about some challenges, but we know that they're up to dealing with those challenges. Amen? Amen. All right. And we know that we will not do anything that the state does not ordain or does not support, but that we will create a system that truly will meet the needs of children. Because we know that children learn best when they are healthy, they learn best when they're present, they learn best when they're connected socially and emotionally to schools, and they learn best when there is hope. And we just thank Dr. Foley, all of the community partners, Family Health Centers of Georgia, in bringing this wonderful initiative to fruition. Thank you.
I'm Dr. Michael Brooks. I'm the CEO of the Family Health Centers of Georgia. And I'd like to recognize our board chair who's here, Ms. Janice Andrews. Would you please stand? Are there any other public officials that we did not acknowledge? Could you raise your hand? Okay. I want to welcome you to this new exciting adventure for us. We have been in the school-based space for about 2 years now, working with Emory at a first school-based center up in near Cobb County. And we want to bring what we've learned there to this center here to be able to provide an academic health center for kids so they can improve their health. It's difficult when you're the third person on the list and Dr. Johnson has made all the key points, but what I want to stress is we were able, at our elementary school to demonstrate pretty much everything Dr. Johnson talked about. We were able to keep the kids in school who were sick. We were able to see the kids when they needed to be seen. We were able to contact their parents and keep them involved in their health care. We improved the attendance in the school. And that's what we are trying to achieve here, and we will achieve here. This is one of many schools, I hope, school-based centers that we have or work with Dr. Foley and the superintendent to put in Clayton County. But what I want to stress is that the Family Health Centers of Georgia is here for the long haul. And we will be here dedicated to providing quality health care, not only primary care, but behavioral health, as she mentioned, to the students. I'd also want to take the opportunity to have you see our mobile unit, which is outside. We will also be providing dental here. She didn't mention that. Because on our mobile unit, we're able to provide dental services. We presently are providing services at Northcutt Elementary and Clayton Elementary to those students there. So we will provide dentistry here as an adjunct to what we're doing in health, because we know if you don't have good teeth, you don't have good health. So we're going to involve that here at this school. But I want to welcome you to our new center. It is beautiful. Thanks to Dr. Foley, she really worked with us to find a good space, and the assistant principal at the time, but now the principal, to help us find a good space to have it. And we anticipate this will be one of many successes we will have here in Clayton County. So again, thank you for attending, and we will have a short tour, but I want to invite all of you while you're here to take a look at our mobile unit. Thank you. I usually forget this, but Ms. Bledsoe reminded me. I really want to thank the people from the Family Health Centers of Georgia who really worked very hard to get this center up and running. It takes a lot, not just me, but a lot of people behind the scenes. So I want to recognize Ms. Linda Abbott, who is our Director of Operations, who's here, Mr. William Bledsoe, who's the CFO, who's here, and Maggie Lord, who is our special envoy to the School-Based Health Center.
I just want to make sure that we all understand that this is a cooperative effort, a collaborative effort. And so as the community people come in, We want to make sure that everybody understands that this is embraced by the community. And I saw Gail Hambrick, Commissioner. So the Commissioner's office is represented here as well. And so we have different agencies from the community coming in to embrace our school system. So I want to make sure everybody understands it's not just the school system, as Dr. Johnson has said, it is everyone. And so we want to make sure everybody has that honor today in opening this first site for us. So again, thank you for being here.
Good morning, board members, educators, and friends of the North Clayton High School Family Health Center. My name is Sean Lee, the class president of the mighty class of 2015 here at North Clayton High School. As a student in a diverse community, one thing I have come to the realization of is that while some of us may have different opportunities than others, we all have the same propensity to get sick or injured. The problem is that some of us can more readily see a physician than others. Having a comprehensive health center at North Clayton High has many benefits. While it is more affordable, but more importantly, it gives the families in the community the one thing I think that every household deserves, and that's quality health care. I can only imagine how heart-wrenching a phone call stating that your child is ill or has been injured can be. Aside from the mental discomfort, it creates a hassle having to take time off of work, time usually lost in trips to pharmacies and seeking medical attention. This family health center provides parents with the comfort knowing that their children are going to be okay. To know that your child can receive the quality care and aid that he or she needs right here at the school and can go back to the classroom and continue to be academically successful can be very relieving. As a student, I am overjoyed with the thought of having a safe place where I can go seek medical assistance for things I wouldn't normally feel comfortable addressing and have total confidentiality. Although this is my last year at North Clayton High School, it eases my mind to know that my alma mater will be promoting healthy living and issuing quality health care. I am grateful to Clayton County Public Schools, Family Health Centers of Georgia, and all of the other partners who work diligently to make this project a success. The opening of this school-based health center is further proof that great things are happening here in Clayton County. Thank you.
I wanted to take this opportunity, please, to acknowledge our County Commission Chair, Mr. Jeff Turner, who is also here to support our efforts. And now if we could have our speakers and Dr. Foley and our two board chairs, we would like to go ahead and do the official ribbon cutting. 1, 2, 3.